Hi, this is Tracy Jones. I work for Dr. Jonathan Yousef. He has some great podcasts, and this one's about testosterone.
Hi, this is Dr. Jonathan Yousef, networking for your optimal health. I am so excited because many of my patients have been coming to me and asking me, can you do a podcast on this? Can you do a podcast on that? So it's kind of motivated me to get this next one out, and it's about testosterone. So many of my patients have or are on testosterone for low active or hypogonadism, which is basically low active testosterone. And it's mainly my male patients, of course. And they've been on the testosterone treatments for either a couple of years, or they just started, or they're asking, should I, or what can I do? So the first question I ask them for my new patients are, do they have positive results on my ADAM questionnaire? So I'm gonna go through those ADAM questionnaires real quick off of the top of my head, and they are: do you have some feelings of tired or weakness? Do you have trouble with going to bed right after dinner? Do you have problems with erections and erectile dysfunction? Do you have trouble with your libido, a very important and very telling of low active testosterone? So if people are explaining to me, and I'm going to just digress for 1 second, if they're asking or they're telling me their libido has gone down, but they still have good erections, I definitely look at their testosterone level, because that's definitely one of those hallmark signs that we see with low T. So after going through those series of questions, and there's probably one or two more, one has to regarding stature, meaning that they're looking at osteoporosis and the effects on your bone health when you don't get enough testosterone. So can you imagine the kind of effects that having low T can affect your relationship? They can affect your motivation, your mood, your performance at work and at home, and just simply may affect the way you feel about life. This is not something that I would take very lightly, and I would expect that it would only decline and lead to worsening medical problems. So the answer is, should you or should you not take testosterone? So here are the problems with taking testosterone. Well, you know that once you start taking testosterone, your functional ability or your brain starts to recognize that it has testosterone. So it doesn't want to secrete the necessary hormones to stimulate the testes to create more testosterone. What does that do? That shuts off some of your natural ability to make some. So I always tell my patients, did you have enough testosterone to even worry about that? If your level is at like 100, 150, lower than 100, you really didn't have that much testosterone to begin with. And I'm not really sure that it's enough to really make you feel better. So definitely taking testosterone in someone who hasn't been making that much testosterone is probably not going to be a concern when it comes to the production of it. Of course, there are other concerning side effects, and I'm going to bring those up, like the prostate. The prostate, for example, can become enlarged from using testosterone. So I always make sure that we do prostate exam and check a patient's PSA. I also think about some alternative options to block some of the negative aspects of testosterone, whether it's from the addition of testosterone or it's from the natural production. So I look at different options in terms of supplements, and there is even some prescriptions that can block the negative side effects of testosterone. What happens when you take testosterone is that your production in the testes become lower. That leads to some decreased fertility, as well as a shrinkage or a decrease in the size of your testes, and that's because it's not producing testosterone, it's not working, and it's not functioning as well. So definitely, you want to also talk to your doctor about some options, and And I throw out some options, and I'm make sure that at least I put this out there. There is alternatives to working on that, and one of which is called HCG, the human gonadotropin hormone, another item that can be added on to help avoid the decreased size of the testes. So, and to help with the production of sperm as well as testosterone through the natural methods. So there are some over-the-counter supplements and also activities that you can do to help raise your testosterone naturally. So if you're at that point where I'm not really sure I'm comfortable with the side effects, I'm not sure if I'm ready to take it to that step, what can I do to naturally bring it up? Losing weight, exercising, especially those big muscle groups like the back or the thigh. Those are definitely 2 or 3 things that you can do. You could look at some supplements that are over the counter that can naturally either increase your testosterone, and I can go through a list of them, but there are many, and then or blocking your estrogen. That's another option. So there's some people who block their estrogen, and that's one way of increasing your testosterone by stabilizing or balancing the other hormones in your system. So aside from finding natural ways, of course, there are prescription methods. And the prescription methods are there's a cream, there's a gel, there is a patch, there's actually a nasal spray, and of course, there is a injection. And the injection is one of my popular ones, as some of the creams are very effective, but unfortunately they can transfer to other people, and the injections can be done maybe once every 2 weeks, although I've had many patients who end up being on it once a week. So definitely you want to look at the different options that might be working best for you for testosterone. So one of my patients came to me, and his friend and him have been working out for quite some time, and recently his friend has sort of declined in the way he doesn't go to the gym with him, and they've been working out for 15 years. So again, a great friendship and a love of getting together and working out. And so he's kind of slowed down in what he was doing with his exercise program, and his testosterone was kind of low, and it was told that his doctor didn't want to give him testosterone because it was going to lead to prostate cancer, and kind of had him worried a little bit. And I don't second guess any other provider's wishes. Of course, I think there is always good reason for everything. There's a family history of prostate cancer, or there's a history of themselves having a lump or something on their prostate. There's no way that I would recommend that they take testosterone. So, we don't know the situation exactly, but in this particular case, I would talk a little bit more and educate them on the possibility of what else can they do naturally, perhaps, or maybe they can look at some supplementation that can be a little bit more effective in getting him back up. Because if he doesn't continue to eat right and exercise, and his mood is affected, his lifestyle can quite change, and it can decline. His mental function and his physical function can be declined to the point where he can have some serious medical problems from that too. So, I know I've talked it up a little bit about all of the different options you can have with testosterone. And, I know that there is also the cardiac risk factors that I want to kind of end with, which, yes, there are been some studies to show these, but that the testosterone increases your cardiovascular risk. But here's what I'm seeing, though. Those studies are flawed, and I assure you we can take a look at them and break them down. None of them are perfect in the way they did their studies and the type of patients that they used. And also, you can't just take testosterone and expect good outcome. You have to eat right, exercise, and do your part to live a good, healthy lifestyle. So when you're thinking about testosterone and bioidentical hormones, appreciate you guys thinking outside of the box, and also listening to all of your potential options that you have and finding out what's best for you. This is Dr. Jonathan Yousef, networking for your optimal health. Hey guys, thanks for listening to another great podcast. This one was about testosterone. If you thought that maybe you had some of those symptoms of low energy, mood, possibly sleeping right after dinner, having troubles with erections or your libido, which is your drive, your sex drive, think about possibly if you want to come and talk to your doctor about some options for your testosterone. If not, at least check your testosterone level and see what it is. Thank you for joining us for another great podcast. This is Dr. Jonathan Yousef, networking for your optimal health. Once again, if you really like the podcast and want to subscribe or give us a review, we'd really appreciate it. We are always thankful for our listeners, as also they are the reason why we do these podcasts. And at this time, I am just doing it to extend your office visits and to share with you some ideas to make it a little bit easier for you to listen at your own leisure and at home. So join us again for another great podcast. This is Dr. Jonathan Yousef, networking for your optimal health.